Are your kitchen and bathroom way overdue for a remodel? Well, I got the guy for you. Call John Sellers at First Response Contracting, 484-256-7136. Both residential and commercial services, and he's licensed and insured. Call him at 484-256-7136. First Response Contracting. All right, you guys ready?
Yeah.
All right, ready. Here we go.
From real estate to real life and everything in between, the Brad Weisman Show. And now, your host, Brad Weisman.
All right, we are back, and we have a repeat guest. You're going to love this, yes. You might see a little bit of what's on the desk there, and no, we are not going to be talking about dinosaur bones. It might look like that from what you see here in front of me, but we brought somebody back who was here before to talk about my wrist. I have carpal tunnel thing that was going on, and everybody has to have a Dr. Oz. So my Dr. Oz, I'm going to call you Dr. T. What do you think, Dr. T?
I like that.
Dr. T is in the house. Yeah. So Dr. Nate Tiedeken, how you doing, buddy?
Good. Been great.
Been great.
I can't believe I got invited back after the first time.
Yeah, it was.
I thought you and Hugo talked.
There was a lot of words back and forth. Hugo said no. I said yes.
Split vote.
Yeah, split vote. And since it says the Brad Wiseman Show and not the Hugo Show,
That's right.
I got first dibs.
You
on
break
the whole
the
thing.
tie.
Yes, I did.
Well,
yes, I did.
It's great to be back.
Yeah.
You guys changed some of your angles around here, I
We
guess?
changed some angles around, and there's still a book on the table here too, Hugo. The book's just laying there from another show.
Why do you have to say that,
And you know, it's
Brad?
funny, and my phone's over there on the table too. It's funny.
We got new angles. I got to get ready. I got to get used to it.
You got to get used to the new angles.
off my game.
Everybody's got to have a new angle. You know what I mean? You got to have a new angle.
I hope it's my good side.
It is. Yeah, from what we were told.
That's good.
But no, so we talked about shoulders a little bit last time, just a little bit. I think we talked about the rotator cuff or whatever, something like that. And mostly what we talked about was the carpal tunnel thing. By the way, I'm still doing great. I don't have to wear the brace anymore, which is wonderful.
Good.
And it worked out great. And I didn't have to have surgery. Everybody thinks you need to go to surgery. No. And you will tell people that you don't have to always, right?
My goal, I say a surgeon's goal should be to try to keep you out of the operating room.
Yeah, right.
Sometimes when everything else fails, that's your last result, but that should be your main goal.
Right. Now, you don't want to cut unless you have to.
Yeah,
right?
absolutely. I mean, surgery is surgery, no matter how big or how small. So you have to treat that with respect. So
exactly.
That's a big thing in my practice, at least. Make sure you've exhausted all other treatments first.
Gotcha. Yeah, that's cool. That's really cool. So the reason we got into the shoulders also is my father-in-law went through a major problem with his shoulder.
Right.
My brother had gone through some really bad issues and has gone through the same physical therapist that I am. Also went to your practice to get the work done.
Right.
And he's very, very happy. And he had something which I never heard of before until my father-in-law and my brother had this done, called a reverse shoulder.
Right.
Replacement, I
So
guess.
a reverse shoulder replacement. Yep. You can get a total shoulder replacement or a reverse shoulder replacement.
Okay. So what is the difference? Because I know what the reverse is. And it to me, it just freaked me out when I realized what it was.
So people study this for like 5 years and you're giving me like 10 minutes.
Yeah.
just you're setting the table tough here.
Okay.
I'll give you the cliff notes.
Yeah, give us the Cliff Note version.
So shoulder pain can happen for a number of reasons. Right?
Okay.
People will always associate shoulder pain with I must have torn my rotator cuff.
Gotcha.
Right? That's what it is. But it's not. You can have inflammation in the shoulder, bursitis, tendonitis. You don't have to have a tear. One of the problems, which I think we'll talk about today, is arthritis of the shoulder. Okay. So there's two types of arthritis in the shoulder. Primary arthritis, which is just wear and tear over time, right? Grandma and grandpa get arthritis.
Gotcha.
Or there's secondary arthritis. Something happens in the shoulder. You tear your rotator cuff. Maybe you don't know about it or you live with it for a long time. And that can result in arthritis from a secondary reason, not just because it's wear and tear.
Gotcha.
So the first thing, and I don't know how deep you want me to get.
No, but the arthritis thing that's from just getting older?
Not necessarily. You can have a fracture of your shoulder, which then results in post-traumatic arthritis.
Okay.
So a trauma.
Okay.
Or you can have a rotator cuff tear, and I'll explain that a little bit to you guys. And that can result in a very common form of arthritis in the shoulder.
Oh, wow.
So you can see an x-ray and immediately know that this person has what we call rotator cuff tear arthritis in the shoulder. So the way you treat them, though, is different.
Gotcha.
And so that's why it's important to have the correct diagnosis before you start a treatment plan, because treating rotator cuff tear arthritis versus treating regular arthritis.
Now, when you say treating it, do you mean operating or talk about physical therapy?
A little bit of both.
Okay.
Right. Because
so some of this stuff, once again, can be solved or not solved, can work better or can get past the pain with doing physical therapy.
One of the first options for arthritis is treating it with either cortisone injections to lower inflammation and therapy, and honestly, activity modifications. So a lot of people who have arthritis, if you try to stop doing what's causing the pain, like painting your ceiling or things like overhead work, that can really actually improve some of your inflammation. Because arthritis is not your problem, right? Arthritis,
it's a result of a problem.
The inflammation that arthritis causes.
Gotcha.
So if you can treat the inflammation, which is causing your pain, well then,
what exactly is arthritis? Is it a tissue swelling? Is that what it is? What is it?
So
it's part of your body. Is it? Can you give me like an analogy of what it might be?
I guess it would be like, I don't know. Here we go with the angle.
Now he's showing stuff. So if you're watching, if you're listening to the podcast, you're not going to know. It's a little tough to get these angles.
Here is
it's opposite usually.
There
we go.
Okay. So this is the ball of your shoulder, right?
Yep.
So we're looking at it if it were right here on me.
Yep.
Okay. So there's cartilage that holds the ball and the socket, and they wear together nicely.
Okay.
So it's a smooth surface.
Gotcha.
All arthritis is the breakdown of that cartilage layer.
Okay.
So when they say you have bone on bone arthritis, you've worn the cartilage down.
Okay. And then when you have bone on bone, that starts to cause
pain because that's where the nerve fibers are in the bone. The cartilage itself won't cause pain. It's the bone underneath it, which will sense pain. So once you wear that down, that can cause the inflammation and that can cause the pain.
Gotcha. So you got to so the inflammation is what's really becomes the issue.
Correct.
And that's why you ibuprofen or doing different things that you can do to reduce the swelling. The cortisone shot, like you said, that reduces the swelling in the form of like a steroid, I guess.
Yeah, steroid. Right? So it's a very powerful anti-inflammatory, steroidal anti-inflammatory.
And sometimes that'll do the trick.
Oh yeah.
Because what does it do? It knocks it down. It gets it down, and then it doesn't come back up again.
No, I mean it usually does, right? Because it's arthritis. So what you do, the idea behind cortisone is to lower the inflammation. The arthritis is still there.
Oh, got it.
So over time, as you use it again and the cortisone wears off, then the arthritis will kick in again. But I mean, I have patients who I see, every year, and they get a cortisone shot, and that's all they need for arthritis.
Well, that's cool. That way, well, if that works, it works, right? That's good.
That's the best treatment if it works.
Yeah. Amazing. Very cool. So let's go back to this whole shoulder, the shoulder reversal versus the shoulder replacement on all that.
Sure.
Let's talk about that because this is something new, right? So the reversal or no? When I say new, 10 years, 15 years?
A little older than that.
Really?
Oh, yeah. Much older than that. But the problem is
when I was doing surgery back in the day.
Yeah, back in your day.
We just didn't do that. Yeah. I used Band-Aids, actually.
So when I trained, about 10 years ago, we actually were doing these fairly often.
Wow.
But their technology has gotten so much better for shoulders, I think, in the last 10, 20 years.
Okay.
That it's really been a good option for people now. Before they used to break down in 5-6 years, or they'd have a lot of failures, but through failure you learn, and they have. But I think there's a lot of confusion out there regarding a regular shoulder versus a reverse shoulder. And so I wanted to try.
I'm going to clear that up.
I'm going to clear that up. For all your viewers. So I don't know, Hugo. Here's our angles.
Yeah.
Now, Nate also was an elementary teacher at one point, so you can see his drawings are very good.
So
very good.
I'm not an artist, but this is about as good as it gets.
Okay, cool. I like it. And if you're listening to this and not seeing it, he's got a picture of a shoulder, basically. It's
a very crude diagram of a shoulder.
Yes.
Now, you're going to yell at me.
It could be a hairdryer too. I'm not sure.
Hugo, Brad's been yelling at me.
It looks like a hairdryer. Like if you look at it this way, like if you hold the handle of the hairdryer there.
This is not bad. So
okay, go ahead. Sorry.
Bad. So anyway, here is your head will be up here.
Okay.
Okay. We'll draw it like this.
Okay. Oh wow, that's really nice.
There you go.
That is not to scale. All right, got it. We'll put it there.
Gotcha.
So here is the rotator cuff coming in. Now, Hugo, he's been yelling at me about the mic, so I'm going to have to move this a little bit here.
That's right. You want me to hold
okay,
this?
yeah.
I can hold it maybe too.
Okay?
You got it?
Good?
That's perfect. That's perfect.
Right, we'll knock this out.
That's actually really good.
So here is your shoulder, and here is the ball part of your shoulder.
Okay.
Okay. Here is the socket part of your shoulder.
Gotcha.
The rotator cuff sits atop the shoulder, and it actually comes in front. You don't need to worry about that one. But the big rotator cuff muscle attaches to the ball.
Right.
The function of the rotator cuff, in addition to moving your shoulder, is to keep the shoulder centralized in the socket.
Oh, right.
So you can imagine on the outside. See, now we're color coded.
Yeah. So
right?
this is not blood. This is actually this is actually just redness here.
Not yet. Not yet.
Yeah.
So here, let's say these are the cartilage layers.
Oh,
okay?
yes, very good.
So there's the cartilage holding it. Now, what happens is this: is if you have arthritis, the red goes away, right? And
so the red goes away,
and now you're wearing bone on bone. So if you want to do a shoulder replacement, you have to treat the arthritis.
Gotcha.
The good news is you still have a rotator cuff that's keeping you centralized in the socket.
Gotcha.
So it's still moving nicely and smoothly.
Right.
So what you can do is...
So if your rotator cuff is okay, this is the way you do it.
You do a total shoulder.
Total shoulder.
Okay, not the reverse.
Gotcha.
Okay.
Yep.
So what you do is you go in, you make an incision, and you would actually cut the ball out.
Gotcha.
Then you would grind the socket down.
Gotcha.
So now you've taken away the arthritis here
And there.
here. Then what you do is you put in a new metal ball. So the new metal goes down the shaft of the bone.
Yep. I've seen
And
this.
it forms this here. And so now you have a new ball. And then you put actually a plastic, technically, component in the socket.
I've seen that. Yep.
For the new socket.
Amazing.
So that is a total shoulder. Okay.
Gotcha.
And the reason you can do a total shoulder is because the rotator cuff is still intact.
Stay with us. We'll be right back.
Hey guys, I want to take a second and thank Comfort Pro. Since 2001, Comfort Pro has been helping customers stay comfortable where they live, work, and play. They have 24/7 emergency service and a 100% customer satisfaction guarantee. If you need help with your heating and air conditioning or indoor air quality, call Comfort Pro at 484-917-1803. Mention the show and receive a free humidifier with the installation of a complete system.
So here's the reason why, if your rotator cuff isn't intact, why you would work on changing this up. So let's say you have a rotator cuff tear, right? It rips off of the bone. Now your rotator cuff is sitting up here.
Oh gosh, that doesn't look good. What do you think, Hugo? It looks like Jaws. I think is that a shark bite that happened? It looks like a shark bite.
That's what happened.
Yes,
Because
okay.
that is gone.
Yeah, so swimming with the sharks is not a good idea because it takes your rotator
Definitely
cuff.
not for this one.
Yeah, okay.
Definitely not for this.
No, this makes so much sense now. I totally am getting this now.
See, I mean,
this is good
not-
stuff.
I told you, I'm not a real doctor.
No, this is
hard.
good. This is
You
it's
can
good
explain
drawing.
it with a first grade diagram. It's probably
That's
not that
right.
hard, right?
A whiteboard and a black marker.
This is all you need.
It's amazing.
So now we know why you do a total shoulder. Let's say you don't have a rotator cuff, right? So what happens? There's other muscles here that I'm not showing, right? One of the big shoulder muscles, your deltoid, will pull your shoulder because you're still using your shoulder all day.
Right.
And it is not keeping it centralized in the socket.
Because your rotator cuff is gone.
Correct. So what happens now is that begins to pull up.
Oh, not good.
It's not good at all.
Not good.
So what happens is you get what we call the dreaded high riding humerus.
Oh, this doesn't look good.
How bad does that
And
look?
it's not in the socket.
Not
So at that point,
it is still in the socket.
it's still in the socket, but it's
is
on the top edge of it.
eccentrically moving.
So does it pop then and stuff? Do you start to feel popping?
No, you don't have to.
No, okay.
Some people can.
All right.
The more the more advanced it gets, but usually no, it's just becomes
Just painful.
Painful.
Very painful.
So then imagine if you went and put a total shoulder in there.
It wouldn't work.
It wouldn't because
No, because you still don't have the rotator cuff
and that's
holding
what-
it in place.
That's what we used to do.
Oh gosh.
So we'd put a total shoulder in, and people
Yep.
would do terrible, obviously,
Yeah.
because we were not understanding the biomechanics of the shoulder.
I get it.
So some smarter people than myself
Which
came along.
this is the part that blows my mind. Hugo,
And-
this
and-
is good stuff here.
and said, well, listen, if we don't have a rotator cuff, we can still keep everything centralized if we flip the ball and the socket.
That's the part that blows my mind.
Reverse total shoulder.
Yeah, so you're basically putting the ball where the socket was.
So you put the ball
there.
here, right, with a big old screw right down your scapula. Okay, so now the ball stays here, and then the socket part.
You guys
over
make
here.
a socket there.
Well, it's made out of metal.
Unbelievable.
Now you put the plastic component here. Now this one's obviously not in place, but
And you get better movement then from that, or better.
So what people will do is they will usually get better movement with it, but it is a pain operation more than anything.
It's a pain operation.
So your pain should greatly improve.
Got it. So less pain.
Yes. Now there are people who do.
I'm thinking you're doing this operation to have more pain. You're like, this is what we do to give people more pain.
This is the goal. This is the
the
goal.
goal
We're
is
trying to
pain. We're
hurt
trying
you
to,
first.
no, but that
No,
that to
that's
me is brilliant.
Yeah, and it is. It's a brilliant idea because it's such a simple idea, right? But the best ones are always the most simple, right?
Yeah.
So all I need is one simple idea.
Could you imagine the guy pitching that though at the doctor's? What do you guys have? Like little meetings? And
yeah,
whatever?
they have like
a doctor's meeting.
Oh, yeah.
So last night I was drinking, and I came up with this crazy idea. We're gonna switch
Yeah.
the ball and the socket, and they're sitting there like, you're kidding me.
Yeah. And they flip,
and they did it,
and it's worked, and it's worked great, and it works great for people who even have bad fractures of the shoulder.
Yeah,
and you can't fix it. This is a great way to give them mobility with decreased pain.
Amazing.
Yeah.
So I know 2 people with that: my brother and my father-in-law. Is that crazy or what?
Because rotator cuff tears, believe it or not, if you took an MRI of 100 people outside, random people, about 40% would have some form of a rotator cuff tear they don't even know about.
It's amazing, right?
So it doesn't mean you have to operate on every rotator cuff tear you see, right? But you operate on the symptoms. And a lot of times over time, those rotator cuff tears can increase.
Right.
And I see a lot of people that come to my office with shoulder pain and they didn't even know they had a rotator cuff tear.
Wow.
But they already have arthritis in their shoulder because it's been decades where they've accommodated.
Gotcha.
And eventually
so the body made it work.
The body makes it work.
And it tries to, right?
Up to some point.
So, right. You said there's that. I remember last time with the carpal tunnel, you said, it won't hurt. It won't hurt. It won't give you problems. And all of a sudden, it starts to give you problems. It falls off of that one spot. Yeah.
Yep. And that's true for almost anything in the body. I think your body can accommodate little changes over time.
Right.
Other muscles fire. But I see a lot of people, they'll have a fall and they'll flare up arthritis that they never even knew they had.
Amazing.
Because it was an acute traumatic event.
Yeah, amazing. When you looked at my back, you did an X-ray of my back, and we looked at that, and you were even just showing me, like, look at here's your discs coming down through, and it was interesting. Like, I don't have really any issues down there, you know, like I don't have any bulging discs or anything like that. Mine's stretching.
Your problem is, I think there's too much muscle mass holding your back up.
Yeah.
So you got to work on that muscle mass.
Yeah, that's weird. I don't think that's the problem. I think I have little muscle mass right here.
That's not muscle.
Yeah, that's not muscle. Yeah. Whew, yeah. No, but I'll tell you, the stretching's working.
Yeah, it works.
It works.
A lot. And that's why I say a lot of these things you don't have to have surgery for.
Yeah.
You just have to be able to be patient with it. We're not very patient sometimes.
No,
right?
we're not at all.
We want to get better fast.
So that was an excellent explanation of that, and I totally get it now. Let's talk about a little bit about more of the other pains you can have. Bursitis. Yeah. Is that having to do with the bursa-sac? Is that why they call it bursitis?
So it is, and here we go. See, this is arts and crafts.
You're not going to use your T-Rex bones?
No, I get nervous with the T-Rex bones. You know?
All right, these are probably your kids' bones, aren't they?
Well,
you take these from their room or something.
My kids, they sometimes they like they're like, what did you hear about today, Dad? What did you see today? I'm like,
oh man, that's funny.
So let me show you what bursitis would be. Okay, now this is back to where we were. Okay, there's the ball and socket part. Okay,
got it.
So bursitis, there are bursa sacs. You're exactly correct. That sit on top of the rotator cuff muscle.
Okay.
And they act as like oil in an engine, right? So that when you move it, it helps everything glide. Because right above this is what? Your collarbone, right? Mm-hmm. So your collarbone sits here and it travels, the rotator cuff travels through this very tiny tunnel.
Yeah.
So your body has to lubricate that to keep it nice and gliding.
Unbelievable.
One of the problems is if you're doing a lot of overhead work, I see in a lot of overhead work, drywallers,
seriously,
construction, painters.
I can totally see painters.
And they'll have very serious pain in the front part and the outside part of their shoulder. Wow. And what happens is they get bursitis. This gets acutely inflamed, just like you would get an Achilles tendonitis.
Yep.
And it can be one of the hardest ones to get rid of because what do you do all day? You're moving your shoulder.
Yeah.
Right. And so you got to be able to get this thing to calm down, but not your shoulder. What do you do when you have Achilles tendonitis? You're in a boot for 6 weeks. You don't run. You
can't do that with your shoulder.
You can't be in a sling for 7 weeks. You'll be so stiff.
Yeah, exactly.
So,
then you also start to atrophy then too, right?
For sure.
Yeah. Right.
For sure. And so you have to find a way in the shoulder to get things to heal, but still be functional while you're healing, which is difficult.
Yeah.
So people can have shoulder pain, like I think I tore my rotator cuff, but no injury. And you look at them and they have a very telltale sign of just bursitis in the shoulder. And that is where actually usually a cortisone injection in that area works wonders for people.
Interesting.
Because it will really lower that acute inflammation.
Yeah. So when that thing's inflamed, is it still doing its job though, or no?
If it's inflamed, it's still doing it.
It's still doing it, but it hurts.
It hurts. It hurts.
It's unbelievable.
I just had Achilles tendonitis, and I mean, it was brutal.
I've heard that
it was brutal.
I heard it is. Yeah.
So I mean, you got to take it easy. And the problem is in the shoulder, it's the most mobile joint, right? It's the most mobile joint in the body. So there's no way that you're going to.
So isn't it? So when you say most mobile, like it does more things. It can go like if you think about your knee goes boom back and forth.
Your knee is a hinge joint, right?
Yeah. This is like
it goes all over,
the place,
all over.
Yeah, it's crazy.
So people can get really inflamed with bursitis, but everyone thinks it's a rotator cuff tear,
right?
And remember, I just said there's a lot of people out there with a rotator cuff tear. The problem is that if you get an MRI on that,
yes,
and it shows a small rotator cuff tear,
they're gonna say it's that.
That's what's causing my pain.
Yeah,
and maybe it is, but there's a lot of things you got to go through before you, in my opinion, start talking about.
Can you fix that tear?
Oh yeah.
You can fix the tear.
Oh, yeah. Rotator cuff surgery is one of the most common.
So you can fix the tear and then put it back where it needs to be.
Oh, yeah. So So here you go.
Is that where you drill through the bone, like with a little washer?
So it's it's almost like a drywall anchor.
Yeah. Okay.
Right?
I think yeah.
So if you have a tear, right?
Yep.
Let's say you have a tear right here, right? And it just pulls off the bone. It's not a big tear.
Yep.
Right. But you got to get it back
in
to
there,
the top part. What you would do is you come in here with a, and this is what you do it arthroscopically, right? No big incisions.
Wow.
Small stab incisions.
Okay, cool.
So you can move a camera and shuttle your sutures around. So then you say, all right, we got to get this back down to the X's.
Yep.
So you take a little drywall anchor and you literally put it back in. You put it into the bone.
Amazing.
Now there's sutures that come out of there.
Okay.
So you take those stitches, pass them through the rotator cuff.
Yep.
And then that will, once you tie it down, right, it'll advance it back.
Unbelievable.
And you'll repair that.
Will that attach then eventually?
Oh yeah.
It'll actually attach.
It takes
to the
about
bone.
6 weeks.
That's it.
6 weeks for that to heal. Now remember, for surgery, you're just showing scar tissue where to go. Right?
You're showing scar tissue where to go.
Because that's how you stimulate a healing response, right?
Okay.
Surgery is controlled trauma
Okay.
to show scar tissue where to go.
Oh, I get it now.
So you want that scar to overlap the tendon and the bone so it heals.
not where it is up there.
Correct.
Yes.
You want to
Got
make sure
it.
that, yeah. So that's,
Wow, never heard it like that before either. That's great way to look at it.
yeah, you learn something new every day.
I'll
here.
tell you, this is good stuff.
Yeah.
So let's go into tendonitis.
Right. So just like we said, you can have a bursitis. You can actually have an inflammation around the tendon itself. So one of the other options is the tendon itself can become inflamed. Now that's a little bit more difficult to treat because you don't want to keep putting cortisone into a tendon itself, obviously, because that repeated cortisone injections, and I hear it all the time. I don't want to do a cortisone injection because I heard it eats away all your tissues.
Oh, right.
No, that's not true. I mean, if you're a baseball player and for 162 games, you're getting one before,
Yeah, that can
bad.
Yeah.
But, here and there, if you need a cortisone injection, there's no long-term effects for that. But tendinosis or tendonitis really is the same as bursitis. It's just involving the tendon.
Got it.
And once again, though, you can get an MRI on that and you'll see that the tendon looks thickened, looked angry, and there's a small tear. And people say, oh, I saw my MRI report. It's a tear. I need fixed.
It's a tear.
Well, no, let's not get there yet. Now, there are some tears you have to fix, right?
Yeah.
Like you fall and that's pulled off. You want to get to those sooner.
Gotcha.
But the average run-of-the-mill shoulder pain that you see that walks through the door or you hear someone complain about is not because they fell outside. This has been bothering me for a year. It hurts me at night. Overhead motions when I try to scratch
your back.
I can't do it. Those are very commonly seen for bursitis, tendonitis, and sometimes small rotator cuff tears, but more so the latter.
Yeah, it's amazing. You have any questions? Yeah, Hugo.
No, I'm just impressed.
I mean, there is.
Did you say depressed or impressed?
No, I'm just man. That's
pretty amazing, right?
Yeah, that's pretty
amazing.
The shoulder is a very difficult thing to really conceptualize, but once you do, and you can dumb it down, there's only so many things that can really cause shoulder pain.
Yeah, it is amazing. Totally amazing. So let's talk about the misdiagnosis is one of the things that we kind of chatted a little bit about. Where some people will come in and they'll say it's neck pain or it's shoulder pain or it's not shoulder pain, it is actually neck pain. I mean, what do you see with that?
So I think one of the things you always have to look at when you're looking at shoulder pain is you got to look a little bit higher. Okay. And what I mean by higher is you got to look around the neck because a lot of people will have mild neck pain. It doesn't bother them that much, but you got to remember all the nerves that come out and go to your shoulder start up in the neck.
Right.
So if those nerves come out and let's say you have arthritis in your neck and it's pinching that nerve or it's inflaming that nerve, that can fire around the shoulder. So there can be some people, I've seen people come in, they're like, both of my shoulders are killing me.
Yeah.
I don't know what. And I'm like, both of your shoulders.
Both of them. Yeah. Right.
Right. And so I don't know what it is. It's just been bothering me for such a long time. And you look at their neck and the nerves that are giving sensation and pain to the shoulders are inflamed.
Oh, wow.
And so it presents in the shoulders.
Yeah.
And people are like, I don't have
Is that
any
where
neck
it terminates to the nerve or is
Some
that,
of them.
Yeah, they terminate maybe
Some of
there
them
and then
terminate
that'll
there.
actually fire at that wherever it terminates, right?
And I'll have people where you can have both. Right? You can have both. Some people come in and they have neck pain and shoulder pain.
Oh, jeez. Those
So
poor
that's where,
people.
That's where your exam.
Do you say, hey, you know what? If I were you, I would just...
it might be time to.
Yeah, I don't know. Like a horse, you take him out to a field.
I'm not in that part of medicine, but
There was another guy that was doing that for a while.
he's
done. I think he's in jail. He's dead, actually.
He's dead. Yeah,
he's dead.
He died.
Yeah, I think he killed himself in prison.
Yeah, something. Or even
There goes the family show. All right. So
this is where you turn it off if you have kids.
yeah, exactly. So it can be misdiagnosed with a neck.
It can.
You know what's funny? I was reading up a little bit. I looked under shoulders today, and then I looked at sometimes people misdiagnose a heart attack
Yeah. See,
for shoulder pain.
see, this is where I tell people I'm not the real doctor.
Dr.
start talking about
Dr.
heart
Traer.
attack.
Then we'll bring Dr.
That's
Traer
where I
and
get
yeah,
on the phone and I call a real doctor and they go. So,
but seriously, that could be.
it's
People
funny-
sometimes go, "Oh, it's my shoulder," but if it goes into your jaw and down your left arm, that could be.
It's funny you mention that because there was just an article I read where someone had chronic shoulder pain and then it was actually presenting in that fashion.
Get
It
out
was
of
more
here.
of a cardiac issue than it was a
Oh,
shoulder. issue.
jeez. Can you imagine that? You keep thinking it's your shoulder, and next thing you know, that's not good.
No, that's every orthopedist's nightmare.
Yeah, absolutely. And like they said, that there's other things that usually go with that, like the
There
fever,
is,
like
there is.
sweating and the jaw and down the arm and all that stuff.
And usually your physical exam, right, should show you that.
Yes,
Because
exactly.
If you move the shoulder and it hurts, that's
Yeah,
shoulder pain.
that's shoulder
But
pain.
If you move the shoulder and they're like, I'm sweating and I have palpitations.
That's
gotta
probably that's probably
I don't
not
think you need to go to medical school.
I'm
to
thinking
diagnose
not
that
the
one.
reversal.
No,
I'm
no.
thinking the reversal is not going to work for
We're
you
not
at that
signing
point.
that person up for total shoulder. We'll put it that way.
Dr. Nate, I have a question. What profession, I was thinking maybe is the baseball pitcher, but what profession suffers more given their work from
Yeah,
shoulder
so
injuries?
honestly, there's a ton of stuff out there for baseball players, especially pitchers.
Yeah.
I mean, the shoulder is not meant to rocket a projectile
100 miles an hour. Yeah, yeah.
100
Yeah.
times every 5 days.
Obviously
And so
not.
What you see with pitchers is a lot more soft tissue injury than really arthritis. So they'll have bursitis, they'll have impingement, which is where the bone can kind of push down on the rotator cuff.
man.
All of those things are much more common in baseball players and pitchers. But you'd be surprised. Any type of overhead, like I even see volleyball players.
Because
of the
because you're doing
serve,
this. Yeah,
that's
right.
Right. So the serve a lot. A lot of rock climbers, believe it or not.
Oh, yeah, because they're hanging from their shoulders a
and
lot of time.
they're always
all-
up here.
It's this, yeah,
right?
it's all
And
that.
So they end
That's
up getting a
right.
lot of stuff too. And rock climbing's a big deal now around here.
Yeah,
there's like a couple places. Over
You'll
here.
never see me do that.
No, I don't
just
do
saying.
heights.
No,
Like,
no.
I don't like going downstairs. Like
Nah,
even out here
yeah,
where you
no,
have
I'm
like
not-
10, 15 stairs, I get a little nervous.
Yeah,
walking down
yeah.
there.
Well, we saw that. We saw that. Yeah, we actually next time we'll hold your hand
Yeah, I was
and you can
wondering.
just close your
I
eyes.
was looking for the
Yeah.
railing. I got nervous right now.
No, but I'll tell you, you're right. Those guys, rock climbing is.
And that's all exerting on your shoulder.
I'm always amazed how they can hold on with just their fingers.
unbelievable.
Like their fingers, their whole body's on their fingers. It's nuts.
I mean, a little off topic, but I saw. Do you ever see the one guy who does it without a
nuts.
a rope?
Yeah, I've seen that guy.
It's unbelievable. That's
That's-
a whole documentary.
I sweat when I watch him. My palms are sweating the whole time. I
remember-
like I'm stressed out when I watch him.
and he was like, I couldn't make it up this time, so I came back down. I'm like, that's probably a good decision.
yeah. Well, did he go down the fast way or the slow way?
And they make up their own. They make up their
Yeah,
own.
it's yeah. We're not doing that.
No,
no, it's
I
not
would
happening.
never-
Not happening.
I do the rock climb at the YMCA, and I get 2 up. I'm like, I'm good.
Yeah,
I
this
made
is
where I
it.
thought I
Yeah,
was
you
gonna
start
go.
crying. Mom. It's exactly it. Where's my mommy? So is there anything else about the shoulder? I mean, you got these nice little things here, but I guess we did most of it on the whiteboard, right?
I mean, honestly, we have some of these. So this is, I mean, just for example, all these colors on there, right?
Mm-hmm.
These are where muscles attach or come off in the shoulder.
Interesting.
So you can see how much is involved with, the anatomy. Of the
Whoa,
shoulders
that's a
for all
lot.
of these things, a lot.
There's a lot of things that can go wrong.
There's a lot of things that can go wrong, and that's why your physical exam is most important in the shoulder. You got to look at the neck. You got to make sure everything's going up here. There's a lot of other smaller joints, not just the ball and socket joint, that can reproduce a lot of pain.
Unbelievable.
Crazy.
So not about shoulders, but let's just talk real quick about the flu. That's really rampant right now.
It is,
You were
yeah.
talking about on the phone. We talked about how, and we've all heard this a lot of times. Is they basically they kind of do a crapshoot and go, okay, this is what we think the flu is
Yes.
going to be, and there's a bunch of versions in that shot, right?
What's also crazy is, so, we got over flu maybe 2-3 weeks ago in my house.
Yeah.
We had 3 kids get it, right? And then I didn't get it.
Now, does that mean
Now,
that you had
my
that?
wife says that's because I'm not around the kids enough.
That sounds like
Oh, you know what?
something-
We go to dinner. I'm gonna say that. I heard you didn't get the flu.
That's
I wonder if
funny.
it's because he's not around the kids that much.
I told her the other day, I'm like, I never get their sicknesses. And she looks at me and goes, oh, really?
That sounds like
That's because
something
when
they would
our
say.
kids are sick, I'm like, get the hell away
man,
from me.
like, stay away,
Yeah,
stay away
yeah.
from me.
That's funny.
They're like, do you want to read a book tonight? I'm like, no. I don't
But
wanna
like
read a
same thing. My son had strep throat and he ended up in bed with us.
Yeah.
I didn't get it.
book. Yeah, I don't know what it is.
That was a while ago.
Remember the whole thing with COVID too? Some people
I
got
never
it, some
got
people
it.
didn't. You know,
I never got it.
Yeah, you don't think you had it?
Nah, I probably did. What? Hey, if you don't test, does that make it that you didn't get it?
Yeah, you never tested. That's why.
Oh, yeah, exactly. Well, that was all.
Well, listen, I have.
They would say, "Get your nose," and I'd be in my ear.
That was negative.
Yeah, it was negative.
All right, listen. Is this a fun show or something? Because I have a shoulder pain's one thing, but I got a question I'd like to
Oh,
ask you.
go
guys. I
ahead.
wanna
Go
get
ahead.
I want to
This
get your opinion.
question back on us.
You go. All right. So listen, I go to this one place and I get a haircut every couple weeks, right?
Yeah.
It's just one of those places you walk in, you just
Sure.
like it's easy. So I go in there on a Friday, I get my haircut. I come home. I think we had something next week, so my wife's like, "Hey, you got to look presentable." So
Yeah.
I go get the haircut. I come back and my wife's like, "Ooh, it's not a good haircut."
Oh, whoa.
It wasn't. All right. Full
Okay.
disclosure,
Okay.
It wasn't.
Okay.
I mean, it wasn't.
All right.
It wasn't blended.
Are you planning on going back there? Because they might watch the show.
So I'm not going to divulge names or
Okay,
locations.
okay,
because-
okay.
And here's why. And this is why I want to get your opinion on it. You too,
Okay.
Hugo. So that was Friday. Okay.
Oh, this past Friday. Your hair looks fine.
No.
Oh,
This
a
is
couple
while
Fridays
ago.
ago.
I'm still processing it.
Okay, got it. Yeah.
So 4 days later, my wife says, "Hey, I'm taking all the kids to the same spot, and we're all going to get all 4 kids haircut." I'm like, "Okay, cool." I got out early. I text her. I said, "Hey, listen, I can pick up 1 or 2 of the kids, take them with me. That way you don't have all 4 there." She's like, "Oh, awesome, thanks." So I drive over. Okay, the guy who cut my hair, okay, is there.
Oh, boy.
Okay, I walk in. He acknowledges me. "Hey, hair looks great." I said, "Thanks, man," and I sit down. My wife looks over at me and goes, "Nate, while you're here, can you get another haircut?"
Oh, gosh. No.
Oh man, that's terrible.
So let me set the scene. So let me set the scene, okay? So I'm sitting there, okay? The guy who cut my hair 4 days ago acknowledged that he saw me, commented on how good my hair was, which it wasn't, okay?
Okay,
It was,
all
it was
right.
not a great cut, but I don't
Yeah,
care.
whatever. Yeah. It
And
goes
so
back.
my wife goes,
This is
Can
great.
you get a new haircut?"
Oh,
I'm like,
no.
and I looked at her and I'm like, how,
Doesn't she doesn't know it's him.
so she doesn't know.
Oh,
she
gosh.
doesn't know. And so she's like, "Hey, you should get a new haircut." I'm like, "Keep your voice down."
Yeah.
The guy who cut it
It's
is
right there.
I mean, from where you are to me, he's cut. And so I'm sitting here, I'm like, "Keep your voice down. He's right. He cut my hair."
Yeah.
She's like, it looks like crap from before.
And she said, "Well," she goes, "just, you don't have to go to him, but
How are you not going to go to him?
go to somebody else."
How? That's right. I could never do that.
So I start panicking because I'm like,
Did you start sweating?
I can't have this conversation with him right there.
No.
He just told me I look good.
Take it out. You got to take that one
Your hair
outside.
looks good.
Start texting her.
So my question is this, okay?
What's the question?
What do you do? Your wife is saying, "Hey, Brad, this haircut, you got to get a new one." The guy who just cut your hair 4 days ago, right, says, "Oh, you look good. Good haircut."
Yeah.
Recognizes me. What do? Do you get a new haircut?
With him. I don't know how I
With him? But now he
or
knows.
no, I would say I'm not getting a haircut. I would text my wife and say, "I'm not getting a haircut. This is very uncomfortable." That's what I would do. There's no way I'm going to somebody else after he just said it looked good.
Okay, I respect that. Hugo, what do you do?
I will
respect
tell
that.
him the truth. I will say, "Hey man, my wife said that I personally like it, but my wife doesn't."
Oh,
She's
like,
right
that's
there.
Throw the wife under the
I'll
bus.
tell you what, that is the best answer.
Throw the wife
That's the
under the
best
bus.
answer.
No,
Yes.
it's the truth though.
So,
Oh, yeah, my wife would kill me if I did that. Kill me.
so I panicked.
What'd you
What
do?
did you do?
I got a haircut by someone else.
Oh my gosh.
What did he say?
Did he say anything?
Yeah, he did.
What'd he say?
So I got up and I walked by him and I acted like it wasn't happening, right?
You just act like it was.
He goes,
that you-
and he looks at me and goes, "Where are you going?" I was like,
oh my gosh, dude, this is so uncomfortable.
I'm just getting a new haircut. And he goes, "Why? I just cut your hair 4 days ago." Like, wouldn't let me off the hook.
Oh man.
You should have just taken off running.
I'm just getting it freshened up. He goes, "It was 4 days ago." And I'm like, and I panicked and I just sat down. I said, "Clipper number 3 on the back and sides blended on the side."
Oh wait, he sees you before you went and sat down.
Oh
in the
yeah, he's
chair.
asking me as I'm going to the chair.
I thought you meant after it was cut.
as I'm going to the
oh
new
my
chair.
gosh, dude.
So I can't go back there.
No.
Yeah,
can't
don't
go
go
back
back.
there.
Yeah, just
No, I would
fine.
never-
I can never go back.
I would never
right?
go
I mean,
back.
I can't.
No, you can't.
Okay, yeah.
Absolutely
Funny.
not. No.
So,
you
yeah,
were.
I could never go back.
See, I would. You know what I would have done? I would have texted Jess and I would have said, "This is where it's funny. We're a little different." I would text her and I would have said, "I'm not. This is not happening
But
right
she's
now."
right next to you.
I would have texted her. I seriously, that's what I do. If you're in a situation like that, just text her. And you know what I do? I go, check your phone.
That's right.
Check your phone.
No, you can tell that
See,
you
I
have
panicked.
diarrhea or that you have to fart. You go outside real quick, and then you text her from outside.
Oh, that's
You know
a
who
good
I'm
one.
gonna text
That's
next
a good
time?
one.
Hugo. When
Yes.
I'm in this situation, I'm texting
Hugo's definitely got the answers, right?
He does.
Oh my God! All right, we got to wrap this up. Longest podcast ever, I think.
yeah, sorry
I should have
about
known.
that. I wanted to ask you my
I
life
love the
situation.
stories.
I got you.
Love the
That's-
stories.
that's very good,
That's a
yeah.
good one. It's a really good one. All right, and next time we'll ask the question, what do you do if the guy driving your bus home from a concert doesn't realize the bus is running out of gas?
That's a good one.
We'll talk about that next time. All right, that's it. Dr. T was in the house. That was a good time. All right, so come see us every Thursday at 7 p.m. You can find us on Facebook, Instagram, YouTube, wherever you want to find us. We'll be there. All right, that's about it. See you. Hey guys, if you're looking to buy or sell a house in Berks County or beyond, let me know. This is Brad Weisman from the Brad Weisman Show. You probably know I'm also a realtor, but I wanted to remind you, if you have any questions or you need anything, please give me a call, 484-256-5836. Thanks.